Hi, I'm Mary Beth Stapleton, Manager of Family and Community Partnerships for Hartford County Public Schools. Welcome to the Parent Academy Real Talk on health education in Hartford County. With me today, I have our health education leaders and teachers to talk us through the health education for Hartford County Public Schools from pre-K all the way through 12th grade. So I'm going to let you all introduce yourselves, and I'll start with Mr. Harbert.
Hi, good morning. My name is Joe Harbert. I'm currently I'm supervisor of physical education and health for elementary and middle schools. I was recently appointed to the director of health and wellness. I'm excited about that opportunity.
Congratulations.
Thank you. This is my 24th year in education. I've had an opportunity to be a teacher, administrator, principal, and most recently supervisor. Absolutely love my roles.
Wonderful, and I'm sure all the children that you've helped and supported over the years. Ms. Pettis.
Good morning. My name is Brittany Pettis, and I am the Health Curriculum Specialist. I began my career as a health education teacher in Hartford County Public Schools, and I moved into this role 2 years ago. And I'm excited to be able to support our health curriculum and the education that our students receive.
Great. Thanks for being here.
Thank you.
And Ms. Basler.
I'm Debbie Basler, and I am the supervisor of high school physical education, health, and athletics. I've been in the system for 28 years as a teacher, as an athletic director, and now as a supervisor for curriculum.
Great. Well, again, thank you all for being here. Really appreciate that. And Ms. Pettis, I'm going to start with you because we've heard, parents have heard a lot about the Comprehensive Health Education Framework. It's a new framework that came out from the State Department of Education. And parents are just curious, why are we hearing about it now? What's happened? What's changed? Could you help parents understand?
Sure, I'd love to give an explanation. The Maryland Comprehensive Health Education Framework was approved in December of 2019. So we're starting to hear about that now because local school systems are beginning their realignment to the new framework. So what that means is that local school systems, including Hartford County, are starting to look at that framework, comparing it to our current curriculum, and looking at what is it within our curriculum that is already meeting those standards and what needs to be revised so that we are in alignment to the new framework. The new framework is released by Maryland State Department of Education and outlines the standards that are to be taught to our students in pre-K through 12th grade. So those standards really explain what our students should know and be able to do by the end of each grade level. And then it also helps to provide guidance to each local school system as we're developing our curriculum so that we can use that guidance to determine what curricula we're going to use in our county, and then also what instructional materials we'll use to help meet those indicators and those standards within our curriculum. It was a collaborative effort to create the framework that was released by MSDE. There were local and national subject matter experts that were a part of that process, local school system leaders throughout many different counties within the state. There were certified health educators that were part of that process, and then also students were involved in that process of the creation of the new framework as well.
That's interesting that students were, and were parents involved too?
So there was once the framework was created, there was a public comment period. I believe I'm not sure if it was 30 days or 60 days in which it was posted. They did receive a lot of feedback about that, and then that helped to guide any changes that were made before the final draft was created.
So just to clarify a couple of the words that you've used, because in education we sometimes have words that parents might not understand.
Sure.
So what is a framework?
So the framework is a guide. It
Okay.
gives us a guide of the expectations of what students should know and be able to do as a result of the education that they receive in the health education curriculum. So what we do at the local level is we look at that guide and we use those indicators to help determine specifically what our framework for Hartford County Public Schools will look like, and really figuring out what instructional strategies we can use to help our students to meet those indicators.
Okay, so really at the end of their time in a certain grade, there are certain things they need to know before they go to the next grade.
Correct.
And that's what the guide helps the central office staff and the teachers and everyone figure out together what they'll learn in the classroom.
Yes.
Very good. Okay, that makes sense. And so to that point, what are some of those topics and skills that are in the framework? And I'll continue with you because you're doing it every day. So let's hear about it.
Sure, and I love that you said skills because
Yeah.
the new framework, one of the great things about it is that it does have a skills-based health education format. And so what that means is that this framework that was put out is really working on helping our teachers to implement a curriculum that is really helping our students to develop health literacy skills that they can transfer into their own life. So the foundational skills that are within that, there's 7 of them. We have analyzing influences, accessing valid information, products and services, interpersonal communication, decision making. We have advocacy for the health of self and others, and self-management as well. And then those skill sets are incorporated into our content units. And we have 6 different content units or topics, grades pre-K through 12. And those content topics include mental and emotional health, substance abuse prevention, family life and human sexuality, safety and violence prevention. It also includes disease control and prevention, and healthy eating.
And so those different topics are absolutely age appropriate as you continue to work through this.
Yes, so those indicators were developed in that process, that collaborative process, and looking at what is age appropriate. And then again, at the local school system level, we still go back and look at what fits best for our county with those indicators, and how do we make that age appropriate within our curriculum and the instruction that's being provided.
So the framework is a guide, and then you use that guide to make it fit our community.
Absolutely.
Perfect. Well, that sounds great. And then we talked a little bit about this, Mr. Harbert, but the topics and skills addressed by grade level, if you go a little bit deeper for parents on, how those are addressed by grade level.
Well, we go through grade bands, pre-K through 2, 3 through 5, 6 through 8, and high school 9 through 12. So once that framework has come out, school systems like ourselves will review that, see where we are aligned and where we need to make adjustments. To refer to those indicators that Brittany talked about, the age appropriate is important. So we have curriculum writers at all levels. They are health teachers, they're experts in their content. We also align with community partners, the health department, Office of Drug Control Policy, MSDE as well, to help in that process. And with a lot of these updates that have happened here with the framework, MSDE has been a big part of that. The change in skills-based education has been a process that we've worked on here over the last few years, and it's really an opportunity for students to engage with that content in a much more meaningful way, where they are practicing those skills, learning from it, and then where it's a skill that they have a better understanding beyond just book knowledge and reading, understanding definitions and terms. So each one of those skills that Brittany identified, our students walk out of the classroom really being able to advocate for themselves moving forward. We start with some of the lower level skills initially to kind of build that foundation, and then we work from there.
So thinking about a parent at the end of the day, and perhaps their child's been in a health class, right? And so they're coming home. What are some of the things that they'll start to see? Are there homework, are there projects related to kind of reinforce those skills in the home environment? Anything connecting to kind of the family? Will they see anything?
There will be some. We're still in a lot of this is the early planning phases of this. I always talk about those dinner conversations.
Exactly, that's what I'm thinking about.
And that's a very real example, like at our household. We talk about what you did today in school. So really, ideally, that's where we would like to be able to go, where students can talk about beyond just some of that content things, where they actually practice some of those skills and can talk about how they can advocate for themselves moving forward. Whatever health skill they may be talking about. And it's really an implementation and an action thing. So I wouldn't say necessarily that you're looking at additional homework, but it's something that, from our standpoint and from our teachers, they feel more engaging, and it's something that draws their students in, and they're more likely to retain this information, have a better understanding.
Well, I think those dinner conversations are the best example of how to reinforce those skills and really talk as a family. How do you approach these skills, and how do you model these as parents and uncles and aunts and grandmom and granddad? So that's great. So we talked about grade level and age appropriate. So thinking about how we're going to move forward, I'm sure there's summer work that has to happen as we align to the new framework that Ms. Pettis talked about. What does that work look like? How do you do that?
It's our work really involves curriculum writing teams, and we have at all grade levels, elementary, middle, and high, where we'll meet, look at that framework, look at areas that we really need to approach first. We had some conversations last week with middle school curriculum writers, where we may some of our work is going to focus on 6th grade, so we can build up from there, from the middle school standpoint. It's really breaking down those skills, finding what is age appropriate and what, as a system, we're comfortable with our teachers. And those curriculum writing teams will create lessons, guidance, resources for our teachers moving forward. And all of that goes through our general curriculum committee. We'll share what our goals are, what we're going to work on, and get feedback. And that committee is made up of several stakeholders within the system and outside of the system. If it's something that involves family life, we have a family life advisory committee that is made up of community members, school representatives as well. So there's a lot of eyes that are on this before things are rolled out in front of students.
So for the Family Life Committee, you have parents on there. I mean, you have parent input, parent help, parent support, parent check and balance about what the content looks like. So we definitely have parent input in the process.
Yeah, we're very proud of our Family Life Citizens Advisory Committee. We have a great representation of parents, community members, school system representatives as well. What we want people to know is there are several people involved in this who come from different backgrounds and have a lot of great perspectives to bring. So it's important to see that, and that that is taken into account when we're working through this. And really, a lot of that work, whether it's our curriculum writing teams, when they create lessons and resources, that information goes back in front of those groups and feedback is given. Some of that work we have to go back and adjust based off the feedback. Mm-hmm. So before it ever gets in front of a student, it's been through a lot of checks and balances.
And to that point, you also have to do, I'm sure, a lot of professional development once it's created. And so what's the timeline for that? How long will that all take for that transition?
It depends on the level. Elementary is going to take longer just because we don't have designated health teachers. It's a shared role in the elementary level between a classroom teacher or a physical educator. The professional development is a key piece, because if we're presenting new information, we want to make sure our teachers are well informed and comfortable with the information that we're putting out. So this can be a process that can take over this entire school year. We will not be introducing new elementary health curriculum this coming school year. We'll be in the beginning stages of planning that and working around and getting community feedback on that process. We're a little further along in middle school and high school, just because we do have those designated health teachers to kind of help that process out. Mm-hmm. But the professional development is a key piece. Many times when we start our back to school PD, any updates, whether it's physical education, health, those updates are shared and presented, and teachers actually engage with that and have opportunities to give feedback and work through there.
Right, and before that though, Ms. Basler, the lessons have to really go through an approved process, right? Mm-hmm. You have some information to share about that process.
Yeah, Mr. Harbert actually alluded to it a little bit in his response to the last question, so I'll just kind of emphasize what he stated. Mm-hmm. But our curriculum writing teams, once they're done with their work, that new curriculum has to go to our general curriculum committee. That committee will either approve it for implementation, or it'll provide us with recommendations on how we can continue the writing process. The General Curriculum Committee is made up of teachers, principals, content supervisors, variety of HCPS leadership positions, as well as board member representation. And then once it goes through that, our Family Life and Human Sexuality unit has an additional check. So that goes through our Family Life and Human Sexuality Advisory Committee, which Joe had talked about. That's where our community representation is in there.
And that's where our parents are as well.
Yeah, and they work together with the educators to kind of approve curricular materials that are going to be used within that specific unit. Joe also alluded to the specific training. COMAR, which is Maryland law, does require that teachers who are teaching the Family Life and Human Sexuality unit receive specialized professional development and training prior to implementation in their classroom.
So after this goes through the entire process of all these stakeholders and all this input and all this revision, when that happens, where in the process, once the implementation happens, right, once your child's in the classroom learning this, can a parent review the information that's going to be shared? Can they opt out if they really just review it and at the end of the day they're just not happy with the content? What can they do?
Absolutely. Our teachers who do provide instruction, Family Life, they have a Family Life letter that they provide to parents or guardians prior to teaching the unit within their classroom. And within that letter just basically says, we're getting ready to teach this unit. Here's a broad scope of some of the content that's going to be covered. It also gives the parents an option to set up an appointment with the teacher, the classroom teacher that's going to be instructing their student, to review any of the curriculum related to family life, that family life unit. Also within that letter, they do have the option to opt out at elementary, middle, and high school levels. They can opt out of individual lessons. They can opt out of the entire unit. If they choose to do that, the students will be provided some alternative assignments.
Oh, good.
And those alternative assignments are basically just enrichment assignments on other content within our health curriculum.
So parents can be reassured that once the process is done, and we've been very public and very transparent about that process,
Yes.
we've shared it with stakeholders, it's been reviewed, teachers are trained, even at the end of that process, and they see the content and the information, they can still choose not to have their child participate.
Absolutely.
Okay. Well, that I think is reassuring for parents to hear. So thank you all so much for being with me today. I know you're very busy people. This is the end of the school year, so lots of things are happening. But we, as parents, are really, I think, reassured to know that you really have the focus of health for our children, that they're healthy children and thriving, and that's really your goal. That's why you got into this work, right? To make sure our children are
Absolutely.
healthy and happy in our community. So thank you for your work every day, and we appreciate your time.
Thank you very
Thank
much.
you.
Thanks. And thank you for joining us for the Parent Academy Real Talk. We'll see you next time.